Hello, in this video we will teach you the basics of a tracheostomy exchange. We will 1. Identify the parts of the tracheostomy, 2. Properly set up the procedure and patient, 3. Correctly position the patient, and 4. Demonstrate proper technique. The purpose of this video is purely educational. Let's go over your needed supplies: tracheostomy kit, 5 ml Luer-Lock syringe, sterile gloves, and a helper. Indications to perform a tracheostomy exchange is bleeding from the site, emergent respiratory distress, or routine care. Before performing the procedure, if time permits, ask the guardian if the patient has difficulty with tracheostomy exchanges. The most common problem is an anxious patient. You might need to consult Child Life, use intranasal or oral midazolam, or other distraction techniques. The goal of this procedure is to complete it in the least amount of time to prevent worsening respiratory distress. Open the kit and examine the contents. With sterile gloves, inspect the parts of the new tracheostomy tube for any tears or defects. You should see the outer cannula that contains the holes on the side flanges to fasten the neckties. On the side flanges, you can identify the size and length of the tracheostomy tube. If the tube is cuffed, you will also see the female port used to inflate the cuff. Within the outer cannula, you will see the inner cannula and the obturator. Lastly, there are neckties. Before continuing, make sure that you have the correct tracheostomy tube size and stoma length. After inspecting the new tracheostomy tube, lay that aside and prep the patient. Release the attached neckties and deflate the balloon with the 5 ml Luer-Lock syringe. With your dominant hand, hold the new tracheostomy tube by the side flanges in between your index and middle fingers with the tracheostomy tube pointing downward. At this point, you should be holding the outer cannula, inner cannula, and obturator all at once. The ties do not need to be attached already. You are now ready to do the tracheostomy tube exchange. Your helper will either ask the patient to take a deep breath in or wait for inhalation prior to removal of the old tracheostomy tube. This will help dilate the stoma. Pull out the old tracheostomy tube upwards and out with some wrist flexion. Quickly then ask the patient to inhale again or wait for inhalation, then insert the new tracheostomy tube. Pull out the obturator of the new tracheostomy tube, leaving it patent, keeping your hand on the newly inserted tracheostomy tube while securing the neckties. Make sure that the neckties are snug, but that you can at least put 2 fingers underneath. Clean off the patient and apply any appropriate dressing. You have now completed this video and should feel confident in performing a tracheostomy tube exchange.